think developing a CLM strategy is important to give some structure to how we go about doing community-led monitoring. I think over the last couple of years, what we have seen is that a number of different ad hoc efforts have been made to do some type of community-led monitoring. And I think having a strategy in which you anchor all of that is extremely important. So for us in Jamaica, what we have done is out of a recognition that, it has been donor-driven, and how do we move from it being a donor-driven intervention to where the country has a strategy that it owns and that we can get the buy-in of all participants, all stakeholders at country level into CLM and not have them feel that this is something that is being imposed from outside. The need for a strategy and a move towards developing a strategy became critical. So in a national CLM strategy, there are a couple of things that need to be included, which I think are important. One is you have to put in your strategy the range of issues that you want to monitor. So are you interested in service quality? Are you interested in service levels? Are you interested in range? Are you interested in seeing the impact of certain, what we might call external factors on service delivery, such as in the case of HIV, human rights issues? You want to make sure that you look at the things that are both direct but indirectly impacting on what that service quality might look like and bring those into the conversation. The second thing you need to put in there, you need to put in issues around resources and resourcing your strategy. So you have to have some sort of roadmap for resourcing your strategy. You also need to have in that as well an implementation plan with defined roles for your various stakeholders, because if you're bringing them to the table, you have to make sure that there is some clearly articulated role for them in your strategy. And finally, you have to make sure that your strategy has some timelines. So what is it that you want to get out of it, by what time, and within that, you also have to have some sort of response strategy. So if certain things are not going in a particular way, what is the mechanism for us to be able to do that? And finally, the governance framework, because your strategy needs to be supported by a governance framework. So how will it be managed? Who will manage it? What will that look like? What is the collective that is going to together work towards implementing that strategy? All of those need to be clearly articulated in your CLM strategy. So the partners critical to developing a CLM strategy are your national disease response. So whoever that is, whether it is your HIV, your malaria, your TB, folks are critical. Your community of people who are affected by the disease are important. And not only people who are infected, for example, in terms of our people living with HIV, but people who are affected by it, who have to use HIV-related services. They become critical. Organizations that are working in the field that do provide some type of service. They don't have to be national government services, but civil society organizations need to be involved. And of course, our development partners and our donors who support and fund some of these interventions and provide technical assistance in terms of rolling out of community-led monitoring are all integral to the strategy. So for me, it is similar to what you do when you're developing your national disease strategy. Those same players need to be involved in your CLM strategy. The key is about relationships and having people understand that you are not coming at CLM from a perspective of fault finding, but that CLM is one component of your national strategies. Every government wants also to understand how well they're doing. And so if you are able to frame that, this will help you to understand where you need to prioritize, where you need to put some resources, where you need to put some additional energies. CLM is critical to doing that. And so by taking it from that angle, you're able to get buy-in. The donors, how you get them to come to the table, you want to support impact. CLM allows you to have the type of information that can help you, even though there may be concerns about rigor. If you say it can provide sufficient information about what the community is feeling, that it will help you to complement the academic rigorous type thing that you think you have. It will bring them to the table. And so we have found that that's an approach that has actually been useful in bringing partners together to accept the need for a community-led strategy.
The role of the data collector in terms of community-led monitoring is to basically extract information from the clinic that they are being serviced in terms of following the indicator sets in which they have been guided by, in terms of finding out the service provisions that are being catered for within the community. So the role is important because they are part of the community, one, and also because they understand the community, they basically become advocates of ensuring that if ever there are certain gaps or challenges that are identified, they take it upon themselves to ensure that there is actually change that is implemented. Because it's community-led monitoring, it's important that the data collectors are recruited from the community, from either with if they are part of a civil society organization that is being catered for within the community. It's very essential that they actually come from the community, because the community understands them and they understand the community in which they serve. One of the biggest advices that I would give is to allow the data to actually speak for itself, to involve all the stakeholders that are actually part of the community, to actually have a voice and be able to vet the information that was actually being provided. So the advocacy should be led by the science that was actually incorporated within CLM. It is very good when people feel like they've been part of processes that they engage in. So to a point whereby if there's actually a proper gap that does not make perhaps the department look good, but because they've actually were part of the processes that were involved, they actually take accountability and reflect and accept that perhaps we've not been doing things right. And I think that is what the power of CLM is. It's not there to basically show that there's mistakes, but perhaps show facts that perhaps this is the way in which we should be moving. And as long as the department has been part of the process, it actually makes the results to be accepted with great ease. Okay, I think one of the biggest challenges that we faced, and it was in terms of data sources, and particularly gender-based violence information not being easily accessible, and even having followed the right procedures in finding which source we need to identify. You find that the information was available in different sources, so it made it kind of like difficult to actually paint the picture of how GBV is within the district. So I think one of the ways in which we rather have planned to aid in this process is engage with the Department of Social Development, Department of Health, also include the South African Police Services in terms of finding out how we can actually triangulate all this information into one, and therefore when we paint this picture, we actually paint the correct picture for the entire district.